You should be able to identify areas of improvement in your current and in our system's current precepting practices, as well as articulate challenges related to precepting learners, rethink your approach to precepting using literature-based techniques, modify your precepting techniques using evidence-based approaches, and design learning experiences to help further optimize precepting. Everyone in this presentation, including Mackenzie Clark, myself, Amanda Morris, and Korana Avdagic, have nothing to disclose and no relevant financial relationships with ineligible companies. We are fully accredited for 2 CE hours. There will be a survey that's sent out with the recording after this session. Filling out that survey is your key to CE credit. So if you don't fill out the survey, I can't get you credit. Other than that, you're welcome to attend if you would not like credit. It is free for all attendees. So that is the end of the disclosures and dry stuff that I have to do. So I will now stop sharing my screen and we'll turn it over to Dr. Clark, who will do our first session.
Great, thanks Dexter, and welcome everybody. Thanks for joining on this Thursday night. Let me pull up my presentation. So we are going to kick it off starting with Strength Finders, which is, I think, a really exciting topic. And as Dexter had mentioned, something that is relevant not only for precepting, but, you know, just everyday life. Oh, sorry, hold on. Oh, there we go. And so I have nothing to disclose, as Dexter mentioned earlier. For this portion of the program, we're going to go over some objectives, mainly focusing on the first two, which is really just a basic concept of Strength Finders, and then how to incorporate Strength Finders as a preceptor. So focusing on that angle. Some other things that'll briefly be covered are just how to recognize your strengths, how to use your strengths as part of a team, and then also identifying the leadership style. A caveat with this is, again, if you haven't, since we weren't able to get the codes prior to, people may have not taken the exam. That's why we'll probably be more generalized in some conversation for those that maybe have taken it in a previous environment. So with that, you know, the big picture of what Strength Finders is a personal development tool. And there are so many of these tools out there. And a lot of times people say, I've done one, I've done them all, and it's not necessarily true. There are so many out there with a different angle, a different methodology, and a different outcome. So a couple ones that you may have done or are pretty common are the DISC test, which is really looking at your personality traits. The Myers-Briggs test is another common one that really looks at how you view the world and how you interact. And then Strength Finders, which we'll focus on today, is really looking at uncovering your innate talent and themes. With that, I'm not sure, you know, I was putting this together and I recognize that I don't know if everyone is actually aware that starting in 2018, the School of Pharmacy, actually, we started doing Strength Finders with our APPE students. So that monthly conference that your students go to on like a Monday afternoon, we actually do this course for them over 3 of the sessions. And I think that that's really important as a preceptor, because what we kind of are going over and what you're learning today is something that they're learning, and we really want them to apply it on their rotations. And as you know, you can sit in a conference for 2 hours and talk about something, but if it's not really put into practice, you kind of forget about it or don't really grasp the relevance and really utilize what you've learned. So this is kind of an example session that we do with our students. They really seem to like it. And again, it's three of the sessions. They're actually doing it currently right now, and we strategically place it so they have time to use it on rotation and then also finish before they go into interviewing for residencies to kind of help them and guide them through that process. So just kind of talking about the basics of Strength Finders, I think my first question to the group is really, how many of you have heard of Strength Finders before? Feel free to raise your hand or put it in the comment section or anything. Awesome. I see a handful of people have heard of it before or possibly have done it themselves. Great. So the basics of Strength Finders is sorry, I'm trying to like, whenever I switch screens, it changes the buttons. Okay, there we go. Is really to look at the path of most resistance. So if we think about society, oftentimes what we see is people thinking about what we can do better and how we can change, and focusing on weaknesses. And the mantra of you can be anything you want to be, you just have to try harder. And so that's, I think, a very common uh, view. And what we see it with Strength Finders is kind of a different philosophical view that really suggests everyone has natural talents and that we'll get farthest in life if we focus on elevating our personal strengths rather than just trying to balance out our weaknesses. So it's really looking at building who you already are, and the thought process of you cannot be anything you want to be, but you can be a lot more of who you already are. Now, it's not to say that it's a specific path. It's saying, like, how can you bring out, even in your career you're in today, how can you bring out your strengths within that role? Not necessarily saying, oh, you have these strengths, so you should be this type of person, but really, how can you mold your day-to-day into bringing out your strengths? And so when we think about strengths, it's a combination of talent, knowledge, and skills. And so in order to capitalize, we really need to understand what those mean. Our strengths are typically made up of our talents. Our talents are a natural part of us, but knowledge and skill are some things that we can change. So we tend to think about, rotations and school as knowledge, and skills where you do on-the-job training to enhance. But talent is what you're kind of innately have inside of you and get uplifted in combination with knowledge and skills to build your strength. There's a lot of studies out there actually that indicate people who have the opportunity to focus on their strengths in their job are about 6 times more likely to be engaged and 3 times more likely to report having an excellent quality of life in general. So, Strength Finders really is thought about as team-based approaches. So we're not necessarily going to focus on that as in this course because we're not necessarily a full team, the 17 people on this call. We're really going to focus on how you can take this back to your team where you're precepting and incorporate your student into it. And one caveat I will say as we go through this, for those that work at UCSF, we are going to be implementing this within our teams. Is that when you take the language literally, so that so this is going to be something that we're doing within our teams, which is great. And I think it's a perfect timing to go over this because you're going to learn about it within like your oncology pod or your ICU pod or wherever you're working. And so you'll be able to kind of be thinking about it. And then as you bring students through your rotations, knowing that your students have been going through this as well, you can look at their strengths and incorporate them into kind of your pod for that 6 weeks. So this is kind of what we go over with the students as well. And one of the first things we do is we introduce it and ask our students some of these questions before they do the exam. So it's actually kind of perfect timing since some people may or may not have had the chance to do the actual Strengths Finder survey. So when you're looking at what are your strengths, these are some questions. I'd love to get some feedback. Either you can take yourself off mute or enter it in the chat. Take about a minute to think about these questions. So think about what you tend to find yourself becoming engaged in. And at work, what's most satisfying? Which part of your work is most satisfying? And what do you enjoy about your day the most? You can think about it today, your week, or any part of work. And so thinking about describing what a successful day is to you, and again, this can be taken in any context, but we're going to focus on work today. And then describe key achievements in your life, or look for what comes easy to you within your work. So I'm just going to take about 30 seconds here for people to think about those questions. And I would love 1 or 2 people to maybe respond to one of these points in the chat, or take yourself off mute. Does anyone, oh, Kathy, do you want to share?
Sure. Yeah. I think that I'm sure a lot of people feel this way when we have like a checklist of things and the checklist continues to grow and grow. But when we're actually able to complete a project or a task or a follow-up or something that has been not like one of those quick and easy, just do it type of things, but like just that sense of checking something off and feeling like you've done something tangible is a part of a successful day. And I would also say if you're able to maybe help a patient or help a coworker accomplish something, that's also a nice feeling of a successful day for me.
Awesome. So checklists and helping coworkers solve a problem. Courtney had mentioned most satisfying is helping find solutions to problems. So a lot of problem solvers. So I think this is really the first step, is really to taking a step back and really looking at, you know, what makes you kind of tick, what makes you happy, and what fills your cup. Anyone else want to share what maybe makes a day successful for them, or maybe even a key achievement in their professional life?
Kenzie?
Hi, Cora.
Hey, I would just add for me, in addition to what was already mentioned, is continuing to learn every day, even as a practitioner already. Just to keep on learning new things makes me cognitively happy, and I will add that.
Awesome. Yeah, I think that's definitely something that also can be cause a successful day for folks. And what's interesting is you bring out characteristics that actually make up some of the strengths that are categorized in the Strengths Finder. So there are actually a list of 34 strengths or talents, they'll call them interchangeable, that are in this assessment that you complete. So what will happen is when you get the link, you'll go ahead and complete this online test. It doesn't take too much time, maybe 10 minutes. And what happens is at the end, you'll get 5 strengths. And so it's really going to be interesting to hear, especially with Cora talking about continuing to learn, or problem solving with Courtney, or helping others with Kathy, if that correlates to maybe some of the strengths that come out of that, because there are certain strengths in here that pertain to like those characteristics. So what happens with the Strengths Finders is you'll get the free top 5. You can pay an extra, I think, $34.99 to get the full list of 34. Now, what this list means is not that you only have these 5 strengths. What it means is that everybody has probably some spectrum of strengths. It's just that there's some that are more prominent than others. So it's not saying that because maybe positivity isn't one of your top 5 that you're not a positive person. It's just that there's 5 other things that really stand out that are more dominant in kind of your inherent talents. So thinking through that, has anyone, and usually at this point, this is the second session with students where they've already completed the Strengths Finder. So we will have kind of their group of strengths. So I'm curious if anyone has completed Strengths Finders before and would be interested sharing their top 5 strengths, or even maybe one of their strengths. Has anyone completed it that'd be willing to share?
This is Kathy. I recently redid it. I did it in 2013 as a PGY2 resident, and Linda had our team do it. We're actually doing a group exercise tomorrow, so I redid it and was surprised to find almost completely different strengths. But one of mine that I can recall, I think achiever was one of them, and I think relator might have been one of them.
Great. And so that actually kind of leads to which we might not be able to fully do today because some people haven't completed it, but I can walk you through some examples. Sorry, my PowerPoint is like not pulling up for me to move is a group reflection. So what we would do here then is list strengths and then go over a group reflection. And so what was your biggest surprise? So this is something, these are questions that will be great for you to go back and think about once you've completed your strengths finders. And we actually provide a worksheet that I can make available for you, or you can just pull up this slide in the PowerPoint. But you know, what is your biggest surprise? Were they all spot on, or was there one that maybe didn't stuck out to you? You kind of answered that, Kathy. I think this is an interesting question to think about too. What would you like for others to see most in you? And this is something I never really thought about, of like, what is it that, you know, is a quality of mine that I really want people to know about me? And I don't know if anyone that's done it would be interested in sharing that piece. Feel free to enter it in the chat or come off mute if you'd like to. Another one is, which impacts the way you interact with people as a pharmacist? So again, taking it into your work and seeing which one impacts you that way. Because again, these are going to be strengths that are not only in your work, but in your day-to-day, but which one probably comes out the most as a pharmacist? And then a last one would be, give us an example of how you have put one of your strengths into action during rotations. So that's a question we ask our students, and you could frame this for yourself as, give us an example of how you put one of your strengths into action, you know, as a preceptor with your students. And so I think that these are really good questions to just take a step back and think about what your strengths mean. I think we so often tend to complete a task, complete an assessment and say, cool, these are my top 5 strengths, but not really analyzing what that really means. And these are some questions that you can use to ask yourself to really evaluate yourself before you start to evaluate how you fit into an actual team. What we like to do with our students is ask these questions. We go around and we talk through it with each other. And we would do that today if everyone had completed it. And then the next steps would be to learn how to lead from the strengths and putting strengths into action. So this is the point after the second group conference with our students. We have them go and they're tasked with trying to implement these into their rotations, as well as analyze and assess their preceptors and see what strengths their preceptors may have, or see if they pick up on things that their preceptors do well or don't do well that might correlate to some strengths. So that's kind of their second assignment. So I think that it's important as preceptors for us to know, because again, our students are very moldable, and they're very, very, craving to understand from and learn from all of you as their preceptors. And so they really do actually watch what you're doing on the day-to-day and how you interact with them and how you treat them and how you treat patients and how you do your day-to-day tasks. And now they're starting to put the pieces together, looking at like what kind of strength you might have. So it'll be really cool to complete it and then be able to have that conversation with the student and really understand how to pick that up with people. So Courtney asks, can you give an example of a student's application of the strengths? Yes. So what we would do is actually go through this next piece and talk about how we go through it together. But yeah, I think that and this is how we would do it, Courtney, is basically we look at our 5 themes of talent. So these are my 5. And similar to Kathy, I actually completed this twice. I had the opportunity when I was an APPE student to do this with one of my preceptors, and I thought it was a really, really cool addition to my rotation because it really did help me understand like who I am and why. And then I redid it again actually when I was in my last role as part of population health, and we did it as a division. And I had pretty much the exact same, besides one trait shifted, which was actually kind of funny. I think it kind of pertains to where you're at in life. I had a competition, I think it was, yeah, competition was one of them at that point in time. And that was when I was like, you know, trying to get residency and all of that. And and now it's changed to, I think it was like Arranger might have been the one that changed. I don't know, but I think that it also kind of shifts a little bit in where you're at in life. But again, competition's still one of my higher traits. So what we would do is look at our traits, and then we would have the students pick a specific strength that they want to analyze. So that's what we would do. So I picked restorative. Now, when I think about the restorative trait and what that means to me, I think about how I actually apply that on my rotations. So if I was a student on my rotations, I'm really energized by problem solving. So restorative, the restorative trait is energized by problem solving, or analyzing the symptoms and identifying what's wrong and finding a solution. So a student, if this was a student, you know, taking this and saying, when I'm on my my rotations and I'm working up my patients, I tend to really, I like to analyze and figure out why someone's having the symptoms that they came into the ED with. And really digging down into what's wrong and asking like the 5 whys to really get down to the problem and find a solution for it. And then I like to bring things to life, meaning I like to bring an idea, like have an idea and make it a reality. And really like complex and unfamiliar problems. So I tend to gravitate, a student in this sense would potentially gravitate towards being on a rotation and having a conversation about maybe developing a program. So when you're looking at, for instance, giving students projects, you know, we never know what students we have on rotation, but once you kind of understand who they are and maybe their strengths, you might change the project you give them as a QI project if you have that luxury of having multiple things. So for instance, somebody with this, I might gravitate towards giving them something that might be a new project that we don't have a lot of guidance on, that requires some problem solving and uncovering, you know, the problems to find the solution. And they like taking challenges and new challenges. So that's kind of one way that you could bring this into a rotation. I'm not sure if anyone else has any comments. I'll pause real quick to see if anyone has any other ways that maybe they've encountered. I don't know if any students have talked about it. I feel like students are shy, so they don't talk about it. From the small pool of students I've asked about this, I don't think that they quite feel comfortable bringing it to their preceptor. So I'm curious if anyone has had those conversations with students or maybe their coworkers.
Hey, Mackenzie, I haven't had these conversations with students, but I think this would be a really good tool to help encourage their learning, as it seems like you guys are using it for. I think it could be a good baseline assessment of how students also learn best and what environments they sort of thrive in. So I could see this bit being really useful, and I think we should encourage our learners to share their strengths with us. And I don't know if this is sort of like Myers-Briggs, because I also have not taken the assessment, but in the fact that, you know, by understanding someone's strengths or understanding their personality traits in the Myers-Briggs, you can sort of learn where they're coming from or how they understand problems or approach problems better. So I feel like this would be a great tool for that.
Absolutely. And that's I think you hit it spot on, Dexter. I mean, and that's, you know, where I think we've done the baseline where the students have done it. And now being able to socialize this with preceptors, you can start bringing that out of your students. And really, you know, we encourage them to share it. But again, I think that if both parties are invested in learning each other's strengths, I think that it'll really help. And Strength Finders really is thought for team-based approach, but I think that it's a great way to take it and put it into your team with your student, which is a little bit different application than you normally see it used, especially because you have your students for 6 weeks often, and maybe within those 6 weeks, you only see them a couple days. So you don't really get the opportunity to spend the time to learn about them. So this is, I think, a good way, as you said, also with Myers-Briggs, to really understand, you know, the people that we're working with.
Hey, Kenzie, this is Tram.
Yeah, hi Tram.
Hey, so I have great news. Actually, our students have taken the Strengths Finder. It's part of their APPE conference. And we've actually gone through and discussed with them their Strengths Finder. So they've actually taken this. So all the students in the San Francisco cohort have done this. And we've actually even talked and grouped them in, which of these types of specific characteristics funnel up to leadership styles. And so, I think they've gotten a basic understanding of where their top 5 qualities are. And so, if you're going to take this, definitely have this conversation with your students, because we definitely encourage them to apply this in their team learning and all.
Absolutely. And this is actually, most of this presentation is actually from the presentation we give the students. So you're seeing actually what they're seeing with some modifications. So, and yeah, I think they just, I talked to Judy, I think they just did it. This cohort just completed theirs. So you could ask your students tomorrow, and they should know their strengths. You know, some students might be like, what are you talking about? But they all have done it. And so there are, after you complete it as well, you get a really cool report from, and I should have mentioned this earlier to you, the Strengths Finders is actually part of the Gallup Clifton package. So Gallup is the Gallup survey that we just did. It's that same parent company that has put in over like 40 years of research into these strengths. So it's on that platform. And the great news is you can access it if you just log in. You know, you can log in and see your old tests if you've ever taken it before. But each of the 5, once you get your report of your 5 top strengths, they'll also give you ideas for action for both yourself and for working with others, which I think is also, again, a really cool tool to analyze how you can work for, like what you should do for yourself, and also how to work with others, both working with others like with your strength, but also working with others that maybe don't know how to work with this, or how to bring your strength to a group. So some examples here are, as I had mentioned, restorative folks tend to be a little bit more problem solving and overthinking and wanting to solve problems. And so sometimes what can happen is you are overcritical. And so it talks about giving yourself a little bit of a break here. Also, use your talents to tackle existing problems, but also to anticipate and prevent problems occurring in the future. And then things I think that was kind of a good check for me when I think about this, again, because restorative is one of mine, is let others solve their problems. Oftentimes, people with a restorative strength, like this theme, tend to, again, be eager to solve problems and can be, not allow others to come to their own conclusions. So that was actually a really good piece for me to think about, that others sometimes need to, that I kind of need to finish my thoughts and ideas for communicating them, and let others maybe connect their own dots and then come together and discuss. And then I think the last one, which was cool, was talking about maybe if you know someone else that's restorative, offer support to those restoratives, because they maybe feel personally defeated if a problem remains unsolved, kind of going back to that wanting to complete a problem and problem solve it. So these are all things, again, that they've put about 40 years of research into. And so there's a lot of advice in there and really great discussion points. It's very, very in-depth. And so I think that it takes a couple times to digest it, but I think that's why talking about it in groups, especially like your people you might be working with, really helps to understand and figure out how to utilize this and put it into action. And so, just a high view, once you've known your strengths, you're thinking about how you can lead from your strengths. And again, I think leading is a very general term. You don't have to be in a leadership role to lead. I believe as preceptors, we're all leaders. We're leading in students and maybe technicians, maybe other, maybe you're a lead pharmacist as well. So we're always leading from our strengths, managing our weaknesses, as well as recognizing your blind spots and helping others build their natural talents as well. So identifying, and that's where you come into a team-based approach, to really think about bringing everybody up to, you know, their talents and bringing everyone up to their best strengths to make your team, you know, as strong as possible. And the great thing about this is that it's not only something you can use in your work environment, which again is our primary focus, but it also is something you can bring into community environments. You can look at if you're a community service in your churches, your family. I think that that's actually something that's really cool, is when people can start bringing it into their family and looking at their family dynamics and seeing what part of the family people, you know, who is what. And then professional organizations, and then also just self-awareness. You know, what is your, you know, professional satisfaction, but also, you know, just doing an assessment for yourself. And there was actually a question that asks, you know, since our strengths change from time to time, what's the frequency you would recommend to revisit to see if they change? And that's actually a great question. I don't have that answer, but I'm sure they have it. I can do a little research and get back to you. I don't know what actually a good frequency is, but that's a really good question. I think I would say mine was what, 6 years apart, five or 6 years apart. Kathy, I don't know how far apart yours was. It seems like yours was probably same area or same duration.
I think I took mine like 8 years ago, but I know with like Myers-Briggs, like those typically are not like anticipated to change with time because it's your preference, like your innate preference. And I think that this is somewhat similar, like it's your innate talents and strengths, but I don't actually know. I don't think it's one of those things where they like say you should reassess it every so often. I think it's just, it's like a series of questions, and it just gives you a few moments to give your gut reflection of what thing you think reflects you best. And so I was surprised to see such a change in mine. I think of the results from 2013 versus the results when I took it earlier this week. I had one strength that was in the same, like top 5 both times.
Yeah, and I just kind of did a quick little search on it, and some said you may not need to take it more than once. Some said maybe every 5 years or so, but kind of just as to echo what Kathy said, they usually don't change all that often, but they could change, and maybe it's because you're in a different environment as well. But ideally, they tend to stay pretty similar. But great question. I think that they also recommended maybe taking it not as frequently, because I think that you can get, you know, selection bias because you know the questions, if that makes sense. So that's why I don't think they recommend taking it like once a year or anything in that capacity. Great. So Tram actually kind of alluded to this. And not only do they have, you know, defining your strengths, they actually have domains of leadership. So I'm going to briefly touch base on that here, which is really looking at what makes people an effective leader. And again, there are people that are usually always investing in their strengths, surrounding themselves with the right people and maximizing their team. So meaning finding, you know, recognizing what job is needed and who's the best fit for that job on their team. And then also understanding their followers' needs or their team members' needs. Again, that kind of goes back to addressing and building people's own innate strengths. Within this Strengths Finders, they bucket all 34 of the strengths into 4 different domains or themes, and they're outlined here in colors. And so executing, influencing, relationship building, and strategic thinking. So executing leadership traits tend to be people that know how to make things happen. They work tirelessly to implement solutions and really can catch an idea and make a reality out of it. You often tend to see people in leadership roles, just managers, etc., in this bucket. Then there's influencing leadership traits. So this is people that help team members reach a much broader audience. They're always selling the team's idea. So this is the person that's going to be pitching you to others and really helping take charge and speak up to make sure your group is heard. So they're kind of the vocal folks that are influencing others around them. You can see some of these traits, activator, communication. People that have good communication skills tend to be in this bucket. The third is a relationship building leadership trait. So these tend to be the people that hold the glue together as a team, and then create groups and organizations that are much greater than the sum of their parts. So they really are looking about how to make the team mesh together and really make people feel like they belong. You see that a lot with connectedness or empathy, relator and positivity, or includer. So some of the key traits in this domain. And then lastly, you have strategic thinking. They're the ones that keep the focus on what should happen. So usually they're the ones that are going to be helping to, keep us on track, and they really analyze and absorb the information to make better decisions. And then they continually stretch the thinking for the future. So looking at what could happen. They tend to be, again, some common traits are analytical, futuristic, ideation. So it will be interesting, actually, at least at UCSF, when we do this as a department, to see, the spectrum of everybody, because you can put them into a bucket, and I'll show you an example of that in a minute. But I did this in my population health group, which encompasses different. I'm drawing a blank on the word right now, but I have nurses, I have our analysts, we have social workers, management. So we had, people of all different job types. And it was really funny to see when you took, various different professions and did it, how certain professions tend to gravitate towards certain. So our entire analytics team was completely in the strategic thinking bucket. And then most of our social workers were in the relationship building bucket, and our nurses. So it's very interesting too, how I think sometimes certain fields tend to, certain traits are more abundant in certain professional fields as well. And really what it is it's not that one of these leadership styles is better than another. It's actually more that we should it's best to have somebody, or identify who is that in each of your, in your team, and see if you have one of everyone, because you kind of want that, right? You want somebody who's going to be executing, but you want somebody that's also going to be strategically thinking for your group, but also making sure everyone's coming together and building that relationship, and someone's speaking on behalf of your group. So this, again, is what they use this for when you're looking at teams. With a preceptor-student relationship, it's a little bit harder to do that, because you're not looking at yourself as a full team, but it really will be nice to just identify where that person might be and maybe what they can bring to the rotation. Again, some rotations may not be adaptable to really changing what the student's day-to-day is, but if the opportunity arises, I think it's really cool to start bringing these and incorporating into how you can guide the student to really flourish on an individual rotation. So this is an example of a group that has done this, and then you categorize each row is a different person, and then you can kind of see where people fall. So most of the people here are in this executing strategy or executing leadership style, but you can see there's a spectrum here. So these people here in the middle might be the ones that you would go to, or might be the ones that inherently that speak out for the group. These ones up here might be the ones that are really looking at relationship building in your group. So it's really fun to look at this as a team and see oh, that makes sense for that person. That totally is that person in our group, before I even knew that these were their strengths. Or the other thing can happen too, where you're I had no idea that was really what you thrive in. And now you can strategize how to bring that out of a person in a team. So I think with this, this is something that Strengths Finders and creates when you have a team. But you can do this by yourself with your own team and keep a running list. It might be kind of cool to do it as people come through and post your strengths somewhere within your team of whoever you work with, to really look at everyone together. And when your students come on board, having them put theirs in there as well, and really look how you all can work together. This is the worksheet that we provide the students. And this is, again, what we do is we go through what we just went through in a little bit more detail, and then kind of ask them to, what do they recognize about their ability to be a leader? I think it's a really important thing for the students to think about at this point in their career, because they're starting to mold into what they want to do and who they are, and really trying to identify that within themselves. And so I think this is a good reflection point for them, to really think about who they can be on the team, and also maybe mold them into what they want to pursue, what makes sense for them. Again, based on sometimes who their preceptors are, and when they see a preceptor that they identify strengths with, and they maybe think about, oh, this might actually be a path that I wouldn't have thought of, but really does resonate because somebody else that has some characteristics as I do, also, they enjoy this role. So I've had that comment from some of our students as well, which is a positive. So just kind of closing this up, thinking about this from a preceptor's view, how can we utilize this strengths as a preceptor? Again, you can utilize this in many ways within a team, but as a preceptor, you can really understand the concepts of strength finders. And I'd love to hear your guys' thoughts on like how kind of learning about it, just 360 view, not maybe completing it yet, you might bring this into your precepting skills, and how we can maybe bring this in and help our students, or even ourselves and our coworkers be better preceptors.
Not necessarily sure if this is overly selfish or not, but looking at that group view, seeing where the students sort of fall in the different categories, I think could be helpful as someone who precepts a lot of students on various research projects. And so I think if I were able to organize them with a couple different students with clusters of strengths from the different areas, I think that could make a really functional team that would give a better results to research projects overall.
Absolutely. I think that's a great thought of, research teams. And I don't think we do this with the residents. Like I said, we do this, all of the students that are coming to you should be doing or have done this, but I don't think residents. So that's actually a great point. But yeah, student research projects.
This is Kathy. I think what I like about it is that it's strength. It's inherently like a positive, like motivating force. And so you can kind of apply it or leverage it in whatever way necessary, but it just takes a positive spin. So if you need someone to improve on a certain area, you could say like, oh, you have this strength of this, the way you can apply it is X, to help them build confidence in making those improvements, but it's coming from a point of like positivity and growth versus deficit and lacking.
Absolutely. I think that's a great point, because twofold there. One, I think we have a lot of students, well, there are some that are maybe overly confident, but I tend to see students very intimidated and don't think that they are good at things. So finding what they're, something to build them up, I think is awesome. There's actually a lot of research out there too to show that, kind of as I mentioned earlier, people tend to be happier and have a better quality of life when they focus on their strengths. And it also, as you focus on your strengths, tends to bring up your weaknesses as well. And once you kind of identify what you're good at, it does help allow you to, gain that confidence and then work on some of those other things as well. So I really love that approach. And so this is kind of the first step I think that you have all done today, is really understanding the concept of strength finders. I think it'll really be important too for you to recognize your own personal strengths as a preceptor, to see what you can bring to the table as well. Where do you fit in as a preceptor, and what maybe what quality can you bring out to really help your students flourish, or your team as well. I also think it's really important to ask students about their strengths. As I had mentioned, and Tram had mentioned, the students all do this, but they may not, inherently come to you and say, hey, guess what my strengths are. So opening that dialogue and having kind of making it the norm, I think will be really cool to see how that shifts dynamics on rotations, and really how it like improves students' engagement. I think it's also an interesting component to ask students how, pre and beginning or the end of a rotation, maybe what brought out their strengths. Maybe you didn't even realize what did. And so it could be a learning tool as well as we go, like, how do you bring out somebody's strengths, or what component worked well for somebody with a analytical trait, etc. Oh, yes, Dexter, APPE students, not IPPE students. Sorry if I had said that. So third year students now. Yeah, IPPE students haven't taken it, well, unless they've taken it somewhere else, but we do it for all the APPE students.
You didn't say IPPE. I just wanted to clarify for myself. Thank you.
Okay, perfect. I interchange it all the time, so I'm not surprised. And I still say fourth year students, so I have to get into the norm of third year students. I actually curbsided some of my previous students that we've done this with and really asked them what they thought about it. They really, really liked learning about it and they thought it was really helpful. But again, what they said is they didn't really feel like it got utilized on rotation. So that's again where how can we really use it to strategize and empower our students on rotation. So I'm curious, talking about, today, does anyone have any ideas of how they might implement something or use this knowledge with their students on rotation? I think there was some mention on projects, but what about kind of just like your day-to-day students that you're trying to teach them about, how to become you essentially?
Kenzie, so this is Tram again. One of my big role in working with students is advising in terms of their career development. And so a lot of this, my conversation with them centers around, what kind of practice environment they envision and where they thrive. And so identifying where they're really good and their strengths are may help them to identify, like, ICU may be a really great environment because, they like that, high intense environment, or are they really more of an influencer? They like to advocate for patients, so maybe in the public health domain, or, do they love communicating with patients? So feeling that connectedness, maybe AmCare, where they get to communicate more. So I think that's kind of how I've been utilizing it a little bit more in talking with my students.
Awesome. I love that. And I think that also goes to show why it's important for them to know what characteristics their preceptors have, because maybe they didn't even realize that as something that would be an environment for them.
Mackenzie, I was going to say, that's Rebecca. I think, having the teams do this would be really important, because even if the student doesn't match one preceptor, they may match another, but it also shows there's, several personality types that ultimately reach the same goal. So, it empowers them to say, oh, I may not have the exact same as the preceptor working with me, but there's several people in the group that have been successful that look like me,
Absolutely. And I think that's spot on. And I'm so excited to have all of the groups build it, because I think you're exactly right. It's not to say that there's one type to do one job. It's just that multiple type, everyone can do these jobs. And then maybe there's somebody that flourishes in one aspect of the job more than others. So I love that as well, that, that just sparked too, when we look at, mentors and mentees, sometimes that might be helpful too, to pair someone either similar or someone that maybe can help improve something that the students are lacking.
Kenzie, it's Cora. Can I just add also, going back to your question, how this could be helpful for preceptors and students on rotations? I think this could be really helpful to get to know students faster in a little bit different way, and maybe help think how to organize, prioritize responsibilities, skills, activities. Not saying that we would avoid one and focus on just certain types of skills, but how to prioritize them, how to maybe tailor them in a better way based on these characteristics.
Awesome. I love that approach. I think you're spot on. And it's really, I think, going to bring a new dynamic to how we precept and how we can really, get creative about meeting people where they are. I think there's obviously certain components of our jobs that you just have to do regardless, but I think that, again, there's different approaches to get there, and let's build people up and be motivating and positive. So I love that. One other thing I think that's also important, kind of as preceptors and kind of in our roles, is we also help write a lot of letters of recommendation, right? Or, coach our students come to us for advice on their interviews for residency or jobs. And so also reminding or thinking about how to apply these, using like this in their strengths. So we try to tell the students that too, like, you're always asked that question in interviews. So you know now what your strengths are and maybe some of your weaknesses. And now you have this tool to, like, you really helped look at yourself. So I think it's also a good tool for preceptors in that sense, that it can help you guide your letter writing. And when you're looking at your student and what you found positive, or maybe an area of improvement for your students. Elena asked, are the fellows in PGY1-2 residents taking this assessment? It would help me in tailoring the rotation experience if I know their strengths from the assessment. That's a really great question. I have to take that back. I'm not going to say yes or no, but I'm assuming they will be, since we're doing it for, kind of all of UCSF, and we tend to tailor the students that way as well. So my guess is yes, but I don't know that for 100%.
I can speak for the residents and say that currently they are not doing it. They do the Myers-Briggs as part of their wellness sessions, but there is potential to add it in, and it's probably a value add to the group. So I think Mandy and I will be talking further about it for at least the PGY1s. I'm sure that the PGY2s will follow suit with that as well.
Perfect. And anyone could actually take it. It's just, I actually don't know how much money it costs to just do it. But
it's $20.
Perfect. I'm happy to sponsor somebody if they don't give it to the residents. So yeah, that's great. Yeah, I think it's really helpful, and I love going back to the this diagram. I love seeing the whole team together, because I think it's a visual way to really assess your team. And that's what when you do it through the organization, it'll group our whole team. So it will be kind of cool also to see our department once everyone's completed it. The good news that next year's PGY1s who recently graduated from UCSF would have already had theirs, and that is true. Anybody that is a UCSF grad in the past since 2018 will have done it, and you can log in and find them. So I just wanted to kind of end today with this quote that I think really embodies what Strengths Finders is about, and it's be yourself because everyone else is already taken. And I think that's really important, and it's really a great message for us to remind ourselves every day, but also help with our students and remind our students that we're all, ourselves. And so we all lead very differently, because we all have different combinations of talents, and there's not one right way. Every leader out there is different, and I think that's what's the best part about it, is you don't want to have just one type of leader. And so more problems actually occur when we think we need to be exactly like somebody else. So, I want to leave this today just really hoping that everyone gets to take the Strengths Finder soon and assess yourself, and then look at how you can work as your team, but also as a preceptor, and really help to build yourself and your students become their best selves. And with that, I think It'll be a perfect segue into Cora's discussion. So I will turn back over to you, Dexter.
Sounds good. Thank you so much for presenting, Kinsey. I think this was a super valuable session. And again, apologize for not having the codes out to everyone so far. They will be forthcoming, and UCSF will sponsor all of you. So everyone here will have the opportunity to be able to take that assessment. I've also recorded attendance here. So if you've taken it before, I know Kathy mentioned that she had, I'm happy to send another code out if you want to take it again. If it's been a little while, just let me know. As soon as I get the approval, I have approval for 30, and there's less than 30 people on this call. So I am able to share it with everyone here. With that, we have the option to take a break. Does everyone want to take a break? Maybe like a couple of minutes, or do we want the full 30 minutes? What do you guys think?
I'd be in favor of just a couple minutes.
All right, I like it. Short break. I'm seeing some nods. I'm seeing Courtney commenting short. Elena says 5 minutes. So I'm down with 5 minutes. So we will meet back at 18:05 and get started for the next session. So grab some water, do a biology break, whatever you need to do, and we'll see you soon. Cora, are you all set for your session?
Yes. Do you mind just, I will turn on again one more time, presenters.
All right, everyone, we are 5 minutes from the last time that we spoke. So we are just on time for Cora to go ahead and give her presentation. And so Cora, I will turn it over to you, and she will present to us on mental health first aid, avoiding burnout. I think a topic that we're all very interested in, coming towards maybe the end, maybe not the end of this pandemic stretch that we're in.
Right, I totally agree. Thank you for inviting me, Dexter, and I'm really grateful for everybody who was able to join tonight, not feeling too burnt out. So let's start. When I was thinking about mental health first aid and what to focus on, there is, of course, a lot of literature in general mental health, but since we have 1 hour-ish, and I want to make it more, the most relevant possible, and more specific, so that we could all also participate. So avoiding mental health first aid, avoiding burnout, preceptor series. So again, I also have no relevant disclosures related to this presentation. In addition to official objectives that Dr. put together for this CE, I also have a few objectives that I was hoping to achieve tonight. I would start first with a brief review of evidence on burnout, just showing some summary of, for me, most interesting and relevant literature that I was able to dig in deeper. And here I have to extend huge thanks to Kat for helping me with a lot of amazing resources and helping me direct and more make a focused search, and when I was putting together tonight's talk. Thank you, Trem. And I'm also hoping that this deck of slides would be of use for anybody later to go back if interested to go deeper into data on the burnout. There's a lot out there, and there are some also helpful links, some of my favorite ones that I put in these slides. But my biggest desire for tonight is to to invite anybody who would like to join open discussion and share their symptoms and causes of burnout as used as a pharmacy preceptor, and then also to discuss together potential strategies to help us reduce burnout. So a little bit about background. Majority of this research on burnout comes from data on physicians and nurses, but there is more and more from pharmacy, from data focused on pharmacists. So American Pharmacists Association found the study by Bridgman in 2018. They found that more than 50% of pharmacists were burnt out, and these were pharmacists from across practice settings and in various stages of their career, so beginning, mid, end. And then a study by Durham in 2018 found that 53% of health system pharmacists that they surveyed reported a high degree of burnout. So what is burnout? The definition comes from the already 1976 by Maslow, who defined it as syndrome characterized by emotional exhaustion. So feelings of apathy, feeling no longer invested in what you are doing, depersonalization, so negative attitude towards work, removal of human aspect, and then loss of work fulfillment. So the loss of work fulfillment is something that could lead to potentially making poor clinical decisions and also making a lot of, or not a lot of, but making medical errors. Gentry and Baranovsky in 2004 described burnout as the chronic condition or perceived demands outweighing perceived resources. I borrowed this slide from AACP CP Pharmacy Virtual Pharm Ed. I really like the graphics here, showing in a simple way that when feeling overwhelmed and exhausted, and while at the same time feeling of not doing enough, this is what can lead to burnout. So what are some general causes of burnout? And I would like to invite everybody to, as I'm going through the slides and the data on causes of burnout from different resources, from data on physicians and pharmacists and nurses, nursing literature, to think about which one of these resonate most for you. And I would like us to share after I go through some of this data from literature. So the first set of causes that could lead to burnout come from actually pharmacist data. This was summarized from another university preceptor series on burnout. So some of those that I found really resonating with me are increased workload and responsibilities, insufficient support and time. And if you want to jot down on the piece of paper, because there will be a lot more coming, at least one or two that resonated most with you, at least at this time. Organizational environments and cultures that are insufficiently resourced to sustain clinicians in their efforts, lack of control in the workplace, inconsistencies between skill sets and actual day-to-day tasks, and then additional work associated with being pharmacy preceptors. And I find this one really resonating, very often feeling torn between trying to accomplish all that we have to do on busy clinical services and finding time to provide quality training and precepting for our learners. The following ones come from actually data on physicians. So these are the some I singled out: having children, work-home conflict, spending less than 20% of time on the most meaningful work. So there are some days, for example, on our services where we have to spend a lot of time on activities we wouldn't even plan or think we would need to spend that much time on for that day. For example, unexpected workers' comp denial, delaying discharge of our patients, or prior authorization, or something else. Think what it could be for you. Moving to a new environment with little support, being a mid-career practitioner. And then the next one comes from the nursing literature, and these really resonated with me. Many of them: lack of support guidance from management, failure of the facility to formalize the preceptor program. So you can see a lot of common topics with all of these professions. Lack of education and preparation for the preceptor role. I think this one is really a valuable one to think about. Students who are not prepared or motivated. Lack of formal recognition of or acknowledgement of the preceptor's value. I sometimes feel that all precept energy that goes into precepting is not visible or recognized, even though I know it is, but it feels as there is a lack of formal recognition sometimes or acknowledgement of all what we do for our learners. And no pay adjustment or other compensation for serving as preceptor. So these are the top ones from the nursing preceptors. And then here I try to even focus it even more on preceptors burnout at UCSF. At UCSF, as a preceptor, we have this general expectation with each learner to do orientation, coaching, and modeling, planning learning activities and experiences. So we have to create activities, experiences, adjust them for each learner. I found that challenging this summer, and I felt on many days this summer burnt out when we had every 2 weeks a new set of students where you had to repeat all of these activities and adjust them for different learners. Total evaluation of each learner. So evaluations are becoming more frequently asked for from the preceptors to be filled as well. They're becoming more lengthy. So they take time and energy to fill, and we all want to provide meaningful feedback. Multiple learners to evaluate, and they all, as we know, differ in their learning style, baseline knowledge, professional experiences, level of motivation, interest in our particular rotation, and just to name a few of those. Repeating tasks for each new rotating learner, as I mentioned, and then keeping up with developments in our field. At the same time, we want to make sure we are also learning and growing and staying on top of the latest data, not just for taking care of our patients with the freshest knowledge that's out there, but also feeling that we want to be the best preceptors. So keep on learning helps also our learning new knowledge in the field helps us grow as preceptors as well. But it takes time too. And then running a complex clinical service 20 shifts per month. This is just another, I felt, useful graphics from National Academy of Medicine, showing, just for your reference, and illustrating factors affecting clinician well-being and resilience. So you can see it's, all of these are well studied and well recognized and documented. So again, this is for your reference to see what all of the factors that are going into providers feeling potentially burned out. And then when it comes to another scale, so actually there are validated scales that help measure burnout. So the one I present, the one most I would say used and known is the Maslow Burnout Inventory. And this one asks participants, as you can see, this is from the survey itself. It asks participants to respond using a frequency rating scale. So never, few times a year or less, once a month, few times a month, once a week, few times a week, every day. And it's asking to, this scale is measuring those things that I mentioned in definitional background by Maslow: exhaustion, depersonalization, and sense of personal accomplishment. So one example, for example, how can I tell if I'm experiencing burnout? How to use this scale? So you would ask yourself, how often have these statements felt true to me in the last year? So if you feel less enthusiastic about my work than before, this could signal possible emotional exhaustion. Or I have become more insensitive towards people since I took this job. Or I have become more callous over time in my current role. This is possible depersonalization. I can't remember why I wanted to become a doctor or a pharmacist in our case. Possible loss in sense of purpose in what we are doing. The third one, that was a low sense of personal accomplishment, is more difficult to measure, and actually there is no single question that could help measure the loss of personal accomplishment. So if you answer to, if your answer is more than a few times a year for any of these statements, it's very likely that you fall into a sphere of relevant burnout. So easy to use, easy to quantify or validate, at least in more official way, feelings of burnout. So what are some consequences of burnout? So I mentioning some of these here: feelings of indifference towards quality of work, increased medication errors, and then when it comes to precepting, decreased communication with students, decrease students' motivation, student outcomes. But when thinking about consequences of burnout, literature documents that providers from any profession tend to think that it's their own individual responsibility, but we have to remind ourselves it's also responsibility of the system. So I really like Maslach and Leiter's framework for burnout, where they say it's paradoxical that most interventions to alleviate the burnout focus on individuals, since the research suggests that situational and organizational factors play a bigger role in burnout. And then the similar tone we have in 2R is human. There is responsibility, not just individual, but the system on patient safety. So I now would like to open it up to discussion. What about you? What's burning you out? Again, my biggest desire for tonight was to have a starting point of maybe in the future we can have more of these if you find them helpful, but at least to start conversation and open to hear each other's thoughts. What are the causes of your burnout? And then later I would like to go through some strategies that could potentially help decrease burnout. So if anybody would like to share in a chat, or even better if they feel comfortable unmuting themselves and sharing their thoughts, I would love. I'm opening up to see, giving time.
I'll start. Fine.
Thank you, Rebecca. I appreciate it. I'm sure everybody has at least one.
I'm sure we have a lot. I'll
Yes.
throw them out there. So one of the things I think is contributing is, like you've mentioned, there's lots of areas, but it's the constant adding on to the tasks that we're being asked to do. Mm-hmm. And nothing being taken off. And so you're constantly trying to reprioritize your day and working out how to be most efficient. And, some people are better at that than others. And so that's just, that sense of, one is adding and not taking off. Two, that constant need to try to prove your value to the med center. And even though we're constantly trying to, we feel like we're value add and we are value add, there's not great metrics to prove our value. Mm-hmm. And so I think that it's constantly feeling like the stepchild, that, we're expensive and we do provide amazing value, but how do we prove that worth? Mm-hmm. As far as precepting, you've got that kind of constant battle of being efficient in your day, constantly proving your value. That's a 10-hour day shoved into 8. And then you're trying to teach and you're trying to show that the resident or student is important enough to take your time. Mm-hmm. And sometimes those are conflicting. So you're, finding that, oh man, I didn't spend the quality time with that person. Now I feel bad. Yet, there wasn't enough time in the day.
Right.
I'll start out there. We could go on and on and on, but right. I think that's nice.
They all resonate with me too. As just adding to the last one you mentioned, Rebecca, is when I try to spend time on teaching, then I feel behind with the clinical responsibilities, and vice versa. I feel bad if I didn't spend enough time. So it's, again, constant battle to feel accomplished at least degree, satisfactory degree on both fields.
Exactly.
These are all resonating with me too. Thank you so much, Rebecca. Anybody else? Kathy? Yes, thank you, Kathy.
I think when you're a student, a learner, and then a resident, you have discrete seasons or phases that there's a light at the end of the tunnel, whether it's good or bad or really amazing or really challenging. It's a discrete point in time and you can mentally get through anything. Mm-hmm. When you're in your professional career, there's no summer break. There's no end of the semester. There's no, I finished my finals, therefore I have nothing to worry about. It's sort of like constant flow of, responsibility and duty. And I think I was surprised to see it, but not shocked when I saw like middle of the career as one of the contributors on one of your previous slides. I never would have thought of that, but it sort of makes sense because it's like you're not the new young person who's sort of very, very eager, and you're also not quite the tenured person who's in the fall of their career. So it's just sort of day in, day out, day in, day out, day in, day out. Constant.
Constant, which can lead to exhaustion and feelings of not fulfillment. I agree.
I can, yeah.
Thank you, Kathy. Appreciate it. These are all wonderful and already help me feel validated in my own impressions of what burnout means for me.
Cora, there's a couple examples in the chat. One validating. That's okay. I'll moderate for you. No worries. One validating what Rebecca had said about not having enough time to finish pre-work or project work and having to multitask all the time. And then the second one talking about reprioritization of work and having to collect metrics to prove our value, which is challenging in itself, as we know that clinical work especially is challenging to collect metrics around. And then just expressing the love of teaching and how valuable it is to teach our trainees, but how challenging that can be to fit into a day of busy clinical responsibilities.
Right. And even with the, thank you, Juan, for saying a JHP with the recent article. I will look into that with the new metrics. But I still feel the metrics can't valid or can't measure all the nuances we do and we contribute to the team, and which can be of huge, not just team, patients, learners, which can be of and often are of huge significance for patient safety, for everything. And it's but then, as Rebecca stated, year after year, it's required to measure it, things that are not easily measurable. So it creates, I think, stress and
yeah. And I just wanted to add to that personally and say that, like, for metrics especially, that can be a source of burnout that I find, because you work and you work and you work to try to move the needle. But as we all know, some of those clinical metrics and precepting metrics are hard to move the needle on and hard to get validation, especially as you mentioned, when there's so a perceived lack of recognition, I guess, from a larger standpoint for excellence in precepting or excellence in, a day-to-day scenario. Especially this past year and a half when we didn't have that FaceTime with learners. So we didn't get that joy of seeing them really get a concept or really dive down deep and understand a great clinical scenario. And I think that's a source that brings us all joy, and just not having that face-to-face experience was really a source for me.
Right, I agree. And then this summer, it felt with a lot of students who our IBP summer experience on our services was the first exposure to clinical, direct clinical patient care. But we felt they were more lost and even the loss for where to work from, how to find an entrance to the building. So it created a lot of stress from these basic things for them, for us to make sure, took time, energy, and then felt there were no enough resources to help. It felt like this year needed even more, we needed more support and more resources for both students and preceptors. But it's challenging here as well. So great, these are wonderful. Wonderful. I'm just looking quickly at the chat. There's Trem shared with all of us useful MBI cost associate, but with MBI, but she's sharing the one to measure well-being. So please refer to the chat for that one. And Kimmery is saying there are so many emails that don't stop. Exactly. Even when you are come back from vacation, it never ends. You feel you can never detach and fully recharge. Great, these are wonderful. Thank you so much for everybody who participated and shared. Okay, great. So I will then continue to see what we can do about avoiding burnout, or at least reducing it. Again, first focusing, and then I will open it again to the group. Avoiding burnout, this is data from the nursing literature. So some of the ideas I thought would be really applicable to us as well to think about. And then please, again, if you want to jot down and share which one resonated more or feel could be most useful to try out in your services or in our department. So appoint someone to oversee the preceptor program, serve as a mentor for preceptors, provide administrative support to acknowledge that preceptor needs time to work with learners, offer decreased tuition for preceptors seeking advanced degrees. I think these are all wonderful ideas. Establish a regular schedule for preceptors to meet as a group to gain knowledge and support from each other. So I thought at least tonight's session would be nice tryout to see how it felt to share and hear each other and support each other, and maybe think, should we think about having these once a month, once a quarter, just to see how we feel when it comes to feeling overwhelmed, when it comes to our well-being, something as a check-in, just a check-in. And then again, make sure preceptors have time to attend the sessions. These are really wonderful from the nursing literature. These come from pharmacy literature, how to help try avoid or decrease burnout. So developing own rotation syllabus, so potentially could give structure to each day. Delegate responsibilities. So for example, engage pharmacist technician colleagues, allow learners to gain a different perspective. Open and strong communication with your learner. Allow learners' goals to guide structure of rotation. So I think here it goes back to Kenzie's lecture, Kenzie's part of tonight's series and session, thinking about maybe doing taking into account the Strengths Finder and see how that could help us guide the structure of rotation for each learner, and thus help alleviate maybe burden, make it easier for both parties, and making it at the same time good experience. So us getting help for students, them having wonderful experience. So something to think about. And then these avoiding burnout. So National Consensus Conference in 2019 actually convened multiple pharmacy organizations were convened, and they collaborated with and came up with 50 or something actionable recommendations. And they were all aimed to promote resiliency of pharmacy workforce and help decrease burnout. And this National Conference focused on primarily on pharmacists, but also residents and students. And then National Academy of Medicine, their action action collaborative on clinician well-being and resilience, also had more than 60 organizations committed to reversing the trend in clinician burnout, and ASHP is part of National Academy of Medicine. So I think also wonderful resources, and also we can see it's gaining a track on a national level with these big conferences and organizations, and just signaling how prevalent burnout is, how there is a trend to try to address it and help, because it can have severe consequences. So these are some of the general strategies from the literature. Again, physician mainly that I put here, but some other ones I try to combine them. But then again, would like the group to think about what could be helpful for them to try in the future, but also if there was something they tried when they felt burnout from a specific cause or event or situation, what they tried to implement that they felt helped them not feel as burnt out, overwhelmed, exhausted next time when they found themselves in the following time when they found themselves in a similar situation. So some of the strategies from physician data is recommending get organized. So they're thinking by this prioritizing, manage your own time. And I like how they phrased it, put yourself on your own schedule. Second one is thinking about physical state. We often forget that, especially when on so many days we skip our breaks and lunches, forget to take a walk or even small to go outside. But these are really important. Sleep, physical activity, preventative care. Maybe think about oftentimes we are not on time to follow up with our primary care provider because there is no time during the day. So maybe thinking about how some of the things, how we can change and be better about taking care of our physical state. And then same goes with thinking about mental state. So some of the ideas from the resource I quoted on the bottom of this slide is connect with the values. So one idea is to write your individual mission statement, or write down inspiring patient stories. From ASHP resources, I found really useful recommended activity to think about. Write down where you felt you learned from your learner and what it meant for you and for the team and for the patient. And how it's wonderful to have a learner. So remind yourself with these organized practices and putting a different spin on the things. Connect with emotions. They understand your own coping strategies. So sometimes an objective outside perspective may be useful. So you can choose to perform weekly or monthly or annual self-evaluation of progress. For example, basic one, okay, I wanted to start meditating and then self-evaluating. I, for example, had this plan to start at least with short stretches of meditation, especially since Corona started. I still didn't get to it. So how to self-evaluate and make sure you help yourself. And another thing that really resonated, how they described it in this resource, the self-evaluation is in service of making progress towards goals, not self-recrimination. So really thinking, I'm doing this to help myself and thus help my work, help my patients, help my learners. Connect socially. I think already this tonight is wonderful example to connect and share, but also thinking about supportive groups, and doesn't have to be at work, can be anything that it sounds, we all I think know about this, but it really, let's try to do it. What appeals to us. Seek professional help also if needed. Don't delay if you need professional help for especially mental health. Find meaning in and outside of work. Start a gratitude journal is one idea. Learn something new. Again, it can be, of course, work non-work related. Take a mindfulness class. And then reflect and refine. I think this one is really really relevant to take a break and reflect and refine. Remember your stated values and compare them to how you spent your time. So these are some of the ideas. So how to be practical about this? How to start? Not just this being a slide with ideas. How do I start? And let's start with small ones, meditation app, for example, or anything else that you think would be beneficial for you, or taking a lunch break. These two links are the resources I really liked. One is actually UCSF, and I found that I didn't even research it, didn't even know how many things they offer for well-being, and thus also helping with burnout. So this is the first link, psychiatryucsf.edu. They have a lot of apps for meditation, for well-being, for sleep, also to connect you with resources, especially during Corona year 2 years now imposed stress. And then second one is ASHP well-being website from ASHP, amazing resources and classes. I was really impressed. So these are the two I singled out and wanted to share with you. So please, if you have time, check them out. They have really useful sources. So now I'm opening to the group again. Let me just be mindful of time. Okay, we are on track, and wanted to see if any of these strategies to try not to completely burnt out or to decrease the burnout resonated with you, or to share if something you tried already and wanted to share with the group. So inviting anybody who would like either chat or muting.
This is Kenzie. One thing that myself and some of my colleagues have, talking about this, have started implementing too, is I think setting boundaries. I think you said something about taking a lunch break. The fact that we never take lunch breaks, like that's usually the norm, is probably a bad thing, right? And so I think that's something that is innate in a lot of the colleagues I've worked with, of just wanting to do what's best, and there's always a lot of work. And so starting to set boundaries, because I don't always think that people, they're coming to you to ask you to do something that's important to them, and they usually don't know what 10 other things you have, and or they're they forget about it. And so it's not that they're intending to, but I found that really helpful. Setting a boundary with myself too, on certain days of stopping work at a certain time, or not taking on X number of projects and saying no beyond that, I think has been really helpful.
Mm-hmm. That's wonderful, Kenzie. I also just going to lunch break. I was making sure I take a lunch break, and then it lasted for a little bit, and then I fell again back into not taking it, and then taking on all of the skipping it, because there is always something to do, and somebody asking you to do something. This is really important. We have to keep on. I think we are all a work in progress, and I have to remind myself to do these things all over again, and I know how it feels much better. You feel more productive. Just a simple example of skipping lunch or leaving on time, or not at least too late. So I agree. Trem, learning to set boundaries and saying no. I'm still learning, but hopefully we'll become better. Anybody else?
I think something for me that's been really beneficial is getting back into reading. It's something that I enjoyed a lot before residency, but then during residency sort of lost my way, and then got really busy with post-residency activities, being a new practitioner. But really making time, either just 10 to 15 minutes before going to sleep, or trying to find a time throughout the day just to read for pleasure. I think those 4 pleasure activities, and even having a small amount of time to do those 4 pleasure activities is really helpful. And as a bonus, I'm reading a book about burnout, so it's really helpful from that standpoint too.
You're well prepared. Yeah, I agree. Even taking at the end of the day 10 minutes to read some of the books that have been waiting for so long on my shelf. But also, for example, I was trying to learn some more Spanish, and it's still so at least even doing 10 minutes of the activity you enjoyed or enjoy doing is, I think, but you have, even it sounds easy, 10 minutes you can do it, but you really have to set your intentions and remind yourself how that's important. Anybody else would like to share strategy? Courtney saying reflect on the good you accomplished that day. I agree, Courtney.
I think one of the things that I try to do is, like, when people come into my office, unless I'm like, it can't be paused, I really do try to take a minute, and we're usually discussing business, but take a minute to ask, like, how are you doing? Or just have that social 5 minutes. And sometimes that's really, it sparks joy, to take a minute to have that connection with people. And I think people shouldn't feel bad that they are taking these moments to have these non-work but positive
human
relationships
moments
with people. Yeah, I think that builds relationships, which I think is one of my, like, talking about Mackenzie's I haven't taken the test. I think it might thing, but if I had a guess, one of my positive things is building relationships. And one of the things that I work on is taking a minute to connect with people. And I think that brings me joy. So I think we should really encourage that, but not to excess amount, but just a little bit. I think it's important.
Small, big things. Thank you, Rebecca. Kathy?
So similar to Dexter reading, I've started listening to podcasts. And what I personally try to do is during work, it's all about work, but after work, I try to not even think or talk about work. And I try to engage in activities that are not depleting and maybe like are just fun, lighthearted topics. Because after a stressful day, I don't want to have to be like constantly triggered or thinking complex, things. And so I watch a lot of Bravo where you don't have to think at all. And I listen to podcasts and I exercise. And I feel like that break and that release from work helps minimize the burnout. And I also think, we've all been surviving this pandemic. It's very mentally draining and we don't have those same outlets and resources that used to help replenish us. So for me personally too, I try to not watch the news and try to like stay off of social media so that I don't continue to get overexposed. Like I like to get the information from the town halls or any informational updates, but I'm trying to like maintain balance with whatever aspects of my day there are. So work has its own balance, play has its own balance, friendships and family has its own balance. And that's been really helpful for me because in the past I was all about work, nothing but work. So
now recognizing the value of being off of work, right?
Yeah, exactly.
Thank you, Kathy. Anybody else would like to share? And I also would like you to think, you don't have to respond today, just to reflect and think, do you feel we could benefit from getting together quarterly as preceptors or monthly, whatever frequency, and checking in, and then also having a space and time maybe to discuss some sharing personal strategies to deal, but also seeing if we can change something systemically in our group, in our department, more concrete things we could do to help feeling less burnt out and overwhelmed at work. Are there things? Are we just taking what we have to do at work with all these responsibilities, or there are things we could change at work? Maybe different schedule with learners. I don't know. I'm just brainstorming, or I know they take time, each group is different, but just thinking if the discussions about that and having space and time, either within your own group or together as for preceptors and pharmacists, would be something of benefit for us. Just an idea to think about.
Cora, I love the idea of our preceptors getting together and talking. And as the current chair of the Preceptor Advisory Committee, it gives me great joy to hear that that's even being discussed. Because, we can't change anything with precepting or can't make any precepting habits any better or do things to help facilitate our preceptors precepting if we don't know about the issues. And so it's really helpful to get together and, talk to each other and hear what everyone's struggling with, because the chances are, if you're struggling with it, someone else is too. And so I think it would be really helpful to at least have something that people can get together and talk.
I agree. It's not just what we do after work to distress, but also what can we do at work to not to get to this. We know that we all love our job and learners, but it gets to the point where it's simply too much. So, but thinking again, what can we do? Something, can changes be implemented? They take time. And we can't address everything at once, but I really liked, that was my idea even before, but then I was really glad to see in literature from nursing that that's what they're implementing and suggesting. So anyways, that's something maybe we can, Dexter, talk about later and see from the input from other preceptors. But thank you. Anybody else would like to add anything for the end of the session? Let me just see if I have, no, I only have references for the end. Spark Social is convenient, socially distant outdoor venue. Yes, I like it. Kenzie.
I was referring to Courtney had said we should reinstate liver rounds.
Yes.
Favor.
In the old days, we could bring alcohol on campus more.
You know, Courtney, when I did rotation after first year of pharmacy school, I did a summer rotation in France, and they all residents.
I love the
were
idea
enjoying
of having a designated preceptor and giving the time that maybe the schedule allots for that, and have been up against barriers on that. And if we as a group feel like this is what we need and the literature to support it, then maybe that is something that we can do, is having a schedule that supports a primary preceptor for residents and a primary preceptor for students. And that gives us the time to dedicate to their learning. That is not a, fitted in and we're not going to give it to you. But as a group, maybe that's something that we go to management for.
I agree, Rebecca. I agree. So I think there will be more of these to come. I'm excited. And for this was really helpful to hear ideas of burnout. Thank you. That's all I had for tonight, and I was really happy getting together, addressing issues. So thank you, everybody. And Dexter,
great. Thank you to our presenters for tonight, and thanks to everybody for joining. I know these sessions are quite late, and maybe now that we have officially announced from this, or have officially been told from the CE providers that the CEs will be, virtual again this year, perhaps we have opportunity to move the future sessions. Our December session has already been scheduled a little bit later, but we do have an ad hoc session that I sent out an invite for coming up on September the 29th, where we'll be talking about letter of recommendation writing. So right before you start getting those requests from all of our residents and learners, it'll be a good time to refresh on those skills. And that one will be a little bit earlier. I will include it here, but I'm still looking for presenters for our spring sessions. So there's 2 sessions, sometime in March and sometime in May. Those dates aren't set in stone or anything yet. But if you're interested in a topic that you think preceptors would benefit from and want to give a CE on it, feel free to contact me offline. I will send out the codes for Mackenzie's Strengths Finders assessment as soon as I have those to everybody that was on and everybody that emailed me. Assuming you didn't contact me, let me know that you did not want to take it. But thank you for your time tonight, and thanks for tuning in. I'll send out the assessment and recordings either later tonight or tomorrow morning for everybody to take the evaluation. Thank you, everyone.
Thank you, Dexter. Thank you, everybody. Thank you. Bye.